So my name's Jenny Stevens. I'm one of the consultant general paediatricians here in the Noah's Ark Children's Hospital for Wales. And we just want to share a little bit about a Nightingale project, which is a new initiative that's taking place in the paediatric outpatient department. So the idea for this initiative came from a focus group that I did last year when I was a Welsh Clinical Leadership Fellow during my training. And I met up with 6 parents from T Gwyn School, which is a special needs school in Cardiff. And I was asking them questions around what sort of issues they face when they're trying to access healthcare for their children. And one of the things that came up was that they would have appreciated some in-the-moment support when they were having difficult news broken to them in a clinic setting. Some of these parents also would have appreciated that on the wards as well. They didn't necessarily want more information about any particular conditions that their child was being diagnosed with. They just wanted some sort of support to help them process what they were actually hearing.
My name is Paul Sawyer and I work for Scope in a project called Face to Face, which is a volunteer befriending service. We work in the community right throughout South Wales and in fact right throughout the country. And as Jenny said, there are a lot of parents of children who have complex illnesses, who have additional needs, who have a disability, who really are struggling for a number of reasons. They can be struggling, as Jenny said, to try and process the information that they've received from the medical staff. They may well have financial issues, they may well have issues with siblings, they may well have issues with partners, all surrounding the condition that their child has got. And as part of my job, I run training groups for volunteer befrienders all over South Wales, and regularly they talk about the time that they first heard the news. Usually, unfortunately, the news can be difficult to process, can be difficult to deal with, and sometimes years later, they still remember in detail how they felt at that time, how they felt disorientated. They couldn't discuss it with family or friends, perhaps even partners. So the volunteer befriending service, which perhaps after the volunteers in the hospital have seen the patients, we can, if necessary, refer them to the community so they can have a longer befriending relationship to develop on the one that's actually in hospital.
So what the service actually entails is that we hope that volunteers will be available whilst the clinics are running, so that if there's any families who have received difficult news in clinic and would benefit from speaking to someone afterwards, then they can be directed to one of the volunteers who will be very flexible in their approach with the families. They may just want to sit down with a cup of tea, they may just want to be ushered to our counselling room for somewhere quiet to sit by themselves, or they may just want to have someone sit and listen to them as they sort of process their emotions of what they've been heard.